Hi, my name's Sarah and I'm a speech and language therapist working with Gloucester Speech Therapy. And welcome back to our mini-series looking at the assessment of people with prolonged disorder of consciousness or PDOC. In this episode, I'm going to focus on the SMART assessment, what it is, how it works and why it's so important in clinical practice. So what is SMART? This is a tool that was developed by the team at the Royal Hospital for Neurodisability in London, and it's recommended in the National Clinical Guidelines written by the Royal College of Physicians alongside other clinical tools such as the Coma Recovery Scale or the CRS and the Wessex Head Injury Matrix or the WIM. So what does SMART actually assess? Well, it's a standardised tool and it's used to assess awareness in individuals with PDOC, particularly when responses may be subtle, inconsistent or delayed. SMART stands for Sensory Modality Assessment and Rehabilitation Technique. It looks at a person's responses across a range of sensory and functional modalities. So it includes assessment of how a person might respond to visual or auditory stimulus or how they might respond to touch and smell, as well as looking at motor function and communication. And each of these areas is assessed in a structured and systematic way, and that allows clinicians to identify patterns of responses that may indicate awareness. SMART is delivered by a trained clinician and it takes place over a minimum of 10 sessions that are spread across several days, and that's really important because then it helps us to build a more reliable, accurate picture. And observations don't just happen in formal sessions. They also include informal interactions which can provide valuable insights into how a person responds in everyday contexts. And we can gather this information by chatting to family and other MDT members who may be having these interactions with people. And what are the outcomes of the SMART? Well, SMART doesn't simply just give us a label. Instead, it helps us to differentiate between states such as vegetative state and minimally conscious state, and that reduces the risk of misdiagnosis. It helps to identify the person's strongest sensory channels, so therefore it supports truly person-centred approach, and that helps guide rehabilitation planning. It also provides robust clinical evidence, which is essential for supporting complex decision-making, including ethical and best interest discussions. And SMART allows us to track changes over time. It helps us to monitor recovery and allows us to adapt our care accordingly. I really hope you found this overview of the SMART helpful. In our next episode, we'll explore how the outcome of this tool can support a rehabilitation programme for a specific client, including consideration of meaningful goals and family involvement. If you work in rehabilitation, medicine, therapy or case management and you're interested in learning more about PDOC assessment and rehabilitation, then please do not hesitate to get in touch. Thanks for listening.